Hello, I'm back. This is Rockson Liu from Emeryville, California, dedicated hernia surgeon. Um, so let's say you had the hernia consult, you really like your surgeon, you had done your research, and you found a really good surgeon who you think is going to be really good for you. Um, I'm going to break this video into two parts. I'm going to talk about inguinal hernia, and then I'm going to separately talk about ventral incisional hernias. Okay. So let's say you have an inguinal hernia. Hopefully, you've been offered a robotic hernia surgery. Um, Now, if you don't want permanent mesh, then this will be a separate video. You don't need to watch this video, but we're talking about the routine inguinal hernia where you're going to have a permanent mesh place, and we can put the mesh in either through the front with an open Liechtenstein, or robotically or laparoscopically using a TEP, totally extraperitoneal method, or a TAPP, transabdominal preperitoneal method. Okay, and the reason I say I hope they offered robotic surgery is because there are many studies that show that minimally invasive surgery, and when I say minimally invasive, I mean laparoscopic or robotic, is better for the average patient. So a typical patient would be a male, right, with a unilateral or one-sided inguinal hernia. And there are at least 3 randomized control trials that I know of that show that laparoscopic surgery is better than open surgery because there's less postoperative pain, there's faster recovery. Okay, and those are 2 very important things I think nowadays. I would say surgery has come along quite a ways, and I would say maybe 30 years ago we weren't quite as focused on the speed of recovery and getting patients back to work. But we lead such busy lives now that we can't afford a lot of downtime, right? Either we have to take care of our kids, or our work is busy, we have a lot of deadlines, et cetera, et cetera. And so we want to get back to life as quickly as possible, and that's what minimally invasive surgery will provide. So if you don't have some extenuating circumstance or some medical issue that would make general anesthesia unsafe, then you should have been offered a minimally invasive surgery. Now, what's the difference between laparoscopic surgery and robotic surgery? The difference may seem minor to most folks, and even to a lot of surgeons, even today. They both require 3 small incisions. They're both under general anesthesia. They both require dissecting, creating the same pocket. They both involve placing the same mesh, right? So what is the difference? Well, the robot is a more precise tool. Okay, that's a bottom line. But the surgeon has to know how to use it and use that precision. Okay, so a very experienced robot surgeon will be much more precise than a very experienced laparoscopic surgeon. So I was a laparoscopic surgeon, and I did lap TEP, inguinal hernia repairs, for about 12 years. Okay, I was very good at it. I really, really liked it. And I really didn't think there was any role for robotic surgery because I was just so good at it. And it was a quick operation. I felt it was bloodless, and I felt like I was treating, all the patients I want laparoscopically. But once I started using the robot, I realized that there were a lot of limitations, and I was compensating for the limitation of the straight sticks, which is laparoscopic surgery. With laparoscopic surgery, there's no wrist at the tip, and I can only push the instrument in or pull the instrument out. I can rotate the instrument, and I can open and close the tip, the jaws of the instruments, and that's it, right? With the robot, I have wrists. I can rotate the tip of the instrument. There's 7 degrees of range of motion with the robot, and so I can be really precise with how I approach the tissue and what direction I grab the tissue, I retract the tissue, how I follow the planes. So it's a really precise way of handling tissue. And then with the robot, I'm sitting at a console, so it's more ergonomic than kind of hunched over a patient, reaching and getting in very awkward positions with my arm and wrist, because With laparoscopic surgery, the instruments are straight, so I have to compensate by distorting my body and kind of accommodating my body to the instrument, which is very hard on my body. And if I'm operating all day, you don't want to be that last patient having a laparoscopic inguinal hernia repair if the surgeon has done 5 or 6 other ones, because that surgeon is going to be tired and their focus is not going to be quite as good. You know how people are frequently afraid of having their surgery late in the afternoon. For lapping inguinal hernia repair, I would say that's definitely the case. With the robot, I'm sitting there all day. I can operate till dinner time and I'd be fine. In fact, I do Kung Fu, so I love that I'm a robotic surgeon, because at the end of the day, I can still do Kung Fu and still feel like plenty of energy and ability to focus. Those are the 2 main differences. The third one is the image with the Da Vinci is 3-dimensional and it's magnified so that I can see a lot of details. In the past with laparoscopy, there are all these little blood vessels that we really don't see laparoscopically, and you just end up tearing it, you get some oozing, and usually it's not a problem, but sometimes that oozing is a little bit more significant and it stains all the tissue. And with surgery, if I can't see the tissue planes, then I have to be rough and rip tissue to create the plane. Whereas if there's no blood, then I can dissect very precisely in the correct tissue plane. I can see the very fine nerves that are hard to see if they're covered in blood. I can see all the blood vessels that are slightly bigger that are significant if I tear them, if there's no blood. But if there's blood covering that, then I won't see it and I can accidentally tear it. Same with dealing with the bladder, right? If I have a very precise hemostatic plane, I know exactly where the bladder is and I know how to be gentle with it. And whereas if I don't know where the bladder is, then I have to kind of push and tear, and I'm more likely to put holes in the bladder, right? So that 3D image with the magnification just helps me see better. And then not only does the instruments have risks, but there's this thing called tremor filtration, right? When I'm operating at that magnified, 10 times magnified level, there's always, there would be a little bit of kind of slight tremor, right? No matter how steady my hands are. And my hands are pretty steady, but without the tremor filtration, there would still be a little shake. And imagine that little shake, even though I would just be like maybe a micrometer off, the precision robot lets me be like so precise down to the micrometer that it makes a difference, right? I could be in an even better plane. Those nerves are definitely going to be preserved. I'm going to be less traumatic with the tissue. And then there's also motion scaling. It lets me be more efficient, right? You know, with laparoscopic surgery, if I move an inch, the instrument's going to move an inch. But with the robot, I can move an inch and the robot can move 3 inches, right? So it lets me, now that I know the planes well, now that I can see really well, I can be really fast with the operation. Whereas with laparoscopic surgery, the movements of the instrument is how fast I move my hands, okay? So those are some of the big differences between robotic surgery and laparoscopic surgery. Now, in a really straightforward inguinal hernia, somebody who's thin, who hasn't had a lot of surgery, who hasn't had any surgeries in the past, who doesn't have a very big hernia, laparoscopic surgery and robotic surgery are probably going to give us pretty similar outcomes. But I would say that's probably 20% of the cases. 80% of the time, maybe the patient's overweight, maybe their hernia sac is a little bit bigger, maybe it's a little bit scarred in, maybe they've had some previous surgeries, etc. It's not always straightforward, and having that robot there is going to make it easier to deal with those not so straightforward stuff. And also, it's better when I encounter something unusual and I need the dexterity to get around whatever structure and be more precise. So that's the difference between robotic and laparoscopic. So I would say there's almost no reason to have laparoscopic surgery today. And if your surgeon is not offering robotic surgery, it could mean one of many things. And, it's going to be hard for you to tease things out, but maybe they don't have a robot at the surgery center that they like to operate at, so they do it laparoscopically, right? Maybe they're just not very comfortable with the robot, so they do it laparoscopically. Maybe they're not very fast with the robot, and they're faster laparoscopically, so they like to do it laparoscopically. I can tell you, a very good robotic hernia surgeon is much faster laparoscopically, because if you step back and think about it, I have risks, right? So I can dissect better. I have 3D vision. I can dissect better. I'm comfortable. I can dissect better. So how can I be slower, right? Now, the robot's not very familiar and it's very clunky. Of course, it's going to take longer, right? There's the clutch pedal, finger clutch. You're having to manipulate not just your two hands, but the scope has to be manipulated rather than your bedside assistant manipulating it. Sometimes there's a fourth arm or a third instrument that you have to pedal swap and do all that stuff. It's a lot of stuff to manage, and it can be kind of overwhelming for some surgeons, so they're slower, right? Or maybe there's some financial gain for them to do a laparoscopy. Whatever the reason is, if I would say if they're not offering robotic surgery, then they're not offering state-of-the-art surgery, because I can tell you that with robotic surgery, there's going to be more consistency with the surgeon's outcome, and you're more likely to get a good outcome with inguinal hernia repairs. So those are kind of the options that are available, for surgeons to offer. I'm going to keep it there. For the next video, I'll continue talking about inguinal hernias and more of the nuances of inguinal hernia. So stay tuned.